I was a National Programme Manager for the NHS Training Division, and I was before then a health research psychologist at Birmingham University. So all through my career, and even before, as an auxiliary nurse, when my children were very small, I came into health, and I've never been able to escape. So just 2 seconds about the association. So we have some 950 members now. We are introducing registration in 2024. We have several routes into the organisation, into membership and into registration. And a little table over there next to the big banners, you can find anything that you would like to take away with you there. Or I do encourage you to have a look at the website. The staff work really, really hard on the website to make it engaging and informative. And so sit down with a cup of tea and 10 minutes with your feet up and have a little browse around there. And we admit qualified health coaches coming from a school such as Active Health Group, coaches with professional professional health experience, but maybe not so much on the coaching side. Coaches with that come from different parts of the coaching space that have been working within health but have never really solidified that experience into any kind of formal recognition. And we now are working very hard to be able to include NHS health and wellbeing coaches. Very recently, the NHS executive have disbanded the personalised care team. So we have something like 1,900 health and wellbeing coaches with no home. We want to give them a home, and we want to share that home with the Personalised Care Institute, and work together properly, collaboratively, to create a unified body and a unified register for health coaches in the UK. I'm just wondering how many of you are health coaches today? Many? Yeah, two. Oh, yeah. Oh, cool. Any of you are clinicians from clinical backgrounds? Oh, lovely. Okay. So most of you, I don't know how much you know about health coaching. We'll have a little look at that as we go on. But let's just move on to... These are all the things a professional body does. I'm not going to go into it at length, but you can see that we keep ourselves very busy. We have these 3 streams: professionalism, enterprise, and community. Professionalism is all about creating those standards, maintaining those standards, clarifying a scope of practice, making sure that our members and our coaches are qualified, skilled, and safe, that they have CPD, that they have career progression opportunities, and that we create those progression opportunities. Many of the coaches work independently, so we do a lot of work with them on business development and how they can grow their businesses and establish themselves as independent practitioners, all work within a loose collaboration with maybe lifestyle or functional medicine practitioners. We have on the right of your screen the community element, which is all about honestly creating that family and that feeling that there is a home to go to. It's not just a professional body that, sort of wraps you over the knuckles if you haven't put your CPD in on time, but it's a family of people who really do look after each other and care for each other. There's lots of networking, lots of forums, lots of interaction through our Facebook groups. And then in the middle there is enterprise, and that's very much about my role in encouraging as many people in the world with an interest in improving public health and population health to understand why it's so important to recognise the skills that health coaching brings to that interaction. It's not just a therapeutic intervention, it's a lot more than that, and I hope to show you why I'm saying that. So this conference is called Pathways to Wellness, and I'm saying that we are witnessing the growing recognition, the validation and respect for the discipline of health coaching. It's a powerful, non-clinical adjunct to every approach to improving people's health. And I've juxtaposed with each subsequent slide, our vision and mission, because I want you to see that it doesn't matter which discipline, it doesn't matter which pathway colleagues here are taking towards helping people improve their health. Health coaching is an underpinning foundation. So let's turn to conventional or allopathic medicine, and we know that we all know that it treats symptoms and diseases with medication and other modalities. Typically, it's a GP referral to other medically or clinically qualified specialists. I would argue, though, although it's a conventional modality, as we've seen by the 1,900 or probably more now of NHS health and wellbeing coaches in post, even conventional medicine is seeing the benefit and the value of health coaching. I'm going to talk a little bit more about what health coaching is in a moment, but I'd just like you to see that the various constituencies and approaches all have the same end in mind. Lifestyle medicine, we know, is an evidence-based discipline. It's all about prevention, managing and reversing conditions. It does rely on behaviour change skills, not to the same extent as health coaching in its own right, but it's all about sustaining lifestyle changes. It considers broader factors, so it's not just the narrow medical factors, and it talks about ecological health, social, economic, commercial determinants of health, and health inequalities. And I want you to see that lifestyle medicine and health coaching are hand in glove. So there we are with our vision and our mission, supporting a discipline that's growing within the UK and worldwide of lifestyle medicine, understanding how we live our lives, what we do day to day can have a huge impact on our health. Functional medicine is not so well known in the UK. I don't know how many of you guys here are familiar with it, but functional medicine modality is all about root cause resolution. It's trying to ask the question why. Why the symptom? Why that symptom? Why that symptom? So it goes upstream to understand why downstream symptoms are happening. It does require, it is highly personalised, so it requires a detailed understanding of each person's genetic, biochemical and lifestyle experiences. Many will say it relies too much on testing, it's too expensive, it's not the kind of thing we do in the UK, but there is an association now for functional medicine in the UK, and it's getting stronger and stronger. So those of you who have not heard, there is actually a coaching school in America that teaches functional medicine health coaching. So that's a really strong modality that looks beyond the symptoms. And it leverages those data that are collected by the testing to create personalised treatment plans. So you can see again how our mission and our vision supports functional medicine colleagues. Whole person health. Now this is closest to my heart really, in that we know in this room, I'm preaching, to the converted, looking at the whole person, not just their organs, not just their body parts, but we are a system of systems. And those systems are smaller and smaller and smaller, and they're determined by our place on the planet, our circadian rhythms, the rhythms of the planet, the health of the planet very much is tied up with the health of those who depend upon it. It focuses very much on restoring health, on promoting resilience and preventing diseases across a lifespan. So for us, it's whole person, whole health, whole life. And it considers a number of factors which either promote health or create disease, and empowering individuals, families and communities. Communities especially. Health does not happen in the doctor's surgery. It doesn't happen in clinics. It doesn't happen in waiting rooms. It doesn't happen in operating theatres. It happens in the community. It happens in the day-to-day things that we do or we don't do as we live our lives. Whole person health considers multiple factors that promote those diseases or in fact health creation through empowering individuals. So we in health coaching are not about telling people what to do, but helping them become self-empowered, autonomous, as Rangan Chatterjee would say, architects of their own health. They are the experts in their life. They are the ones that should be working hand in hand and must be given the confidence, I think, as Rosemary eloquently put this morning, it's the confidence building for individuals to feel that they can participate in their own health. And again, it takes a holistic perspective. Clinical psychoneuroimmunology, my goodness, what a mouthful is that. When I did my psychology degree many years ago, my tutor my third year project was in psychoneuroimmunology, and everybody thought I was mad because no one had heard about it. Like, what are you doing that for? It's not relevant. I am so pleased to see that this is becoming stronger and stronger as a discipline. And I think because it really embodies the whole health perspective, and it does look at biological systems and the interaction between our neurology, our immune system, and our endocrine and hormonal systems. And I don't think it's any coincidence that our director of standards is a clinical psychoneuroimmunologist by training, as well as a health coach and a nutritionist. So I think that unseen hand that guides us to each other and our energies was definitely working on the day that I spoke to Faye Hall and brought her into the association. So P&I brings the focus back to people. And it's the lived experience, it's the existential perspective that I think you'll all be, very much on board with. And it gives the patient a leading role in creating their health. And as you can see, our vision and our mission at the association is absolutely aligned with that. Complementary medicine. I don't need to explain what that is, but what I would like to say about that is that every person who visits a complementary medicine therapist or practitioner will benefit from a health coaching approach. I personally have experienced massage, chiropractic, osteopathy, acupuncture, meditation, yoga, Tai Chi. I can't do it very well because my knees are rubbish, and Reiki. And I'm just about to start art therapy because I need to de-stress from my crazy job. So whilst these are all therapeutic interventions, the health coaching approach is about helping people keep going back to that, helping them change their mindsets and behaviour. So it's not just a flash in the pan, I do it for a few weeks, or I go on a course and then life takes over. It's very much more profound than that. It's not just behaviour change, but actually looking to understand and getting an individual to really be at home with what is important to me in my life. And personalised care is very much an NHS concept. very welcome, representing that new relationship between people, professionals, and the healthcare system. We can't say that it's working brilliantly everywhere, but they are putting a lot of effort into changing the system so that individuals can feel more that what matters to them is being addressed, and that they have more choice and control over the way that their care is planned and delivered, notwithstanding the huge problems that the NHS is facing at the minute. And you may think, well, this is nonsense, it's not happening. But believe me, staff are trying to make it happen. Supported self-management is another aspect of personalised care. It's part of that commitment by the NHS to make personalised care the norm, to encourage, support, empower, manage ongoing physical and mental health conditions. This is the grist of health coaching. And you can see that our vision and our mission for health coaching is absolutely on that page and supporting it. Holistic medicine. I think this is another growing aspect. I used to be on the a trustee for the British Holistic and Medical Association, and they are growing now more and more because they feel that we can use the word holistic in conventional conversations. And I'm very proud to say that I've benefited and am benefiting even now from TCM, from Ayurveda, from acupuncture, from homeopathy. So each of these disciplines is an expert intervention. What I'm saying is that health coaching will underpin that. A health coaching approach is a different kind of conversation. It's not from the and I'll come to this in a moment, not from the expert, but from the patient's perspective. And of course, finally, integrative medicine. An evidence-informed model of healthcare that treats the whole person, brings together a wide range of conventional lifestyle and holistic approaches to support health and well-being. Now, I think integrative medicine and personalised care is the whole, it's the deal. But if nothing changes, nothing changes. And it's very easy for expert therapists, practitioners, to be doing the same thing without seeing behaviour or mindset change in their patients or their clients. And we think that, well, we know from our experience of our membership is growing all the time. We have many, many clinicians and other qualified therapists, so they're dual-scoped, who have either taken courses in health coaching and have come into as affiliate members, or who have done the whole deal. I've never met one that says, I wish I hadn't done a health coaching course. Not one. It changes their practice. So what is health coaching? It's a non-clinical, evidence-based, non-judgmental, client-led, active process. It equips, enables, and importantly, self-empowers an individual to respond and adapt positively to challenges in their internal and external environments. It can create and it can maintain a state of resilience through the pursuit of activities. That's the thing, you have to take action. It's not a passive modality. That individual has to take action, and that's where the skills of the health coach come in, to help them decide where to start, what's important to them, how to carry on. It helps them increase their choices and their lifestyle activities and the things that they do or stop doing in their day-to-day lives to support whole health. And on the right you see there what we call the three-legged stool. So if you imagine your patient or client sitting on the stool, we want them to be in a process of health transformation. Importantly, the client or the patient sits in the middle. Theirs is the firm leg of the stool. On the left-hand side is the healthcare practitioner, the expert hat. They're the ones who will diagnose, will treat, will recommend, will give advice, will say, Izabella, you have this condition, we recommend, we diagnose, we prescribe, whatever it is. I can come away from that thinking, oh my goodness, there are 19 things I need to change. Where do I start? What is it? Where do I start? I've been to see a nutritionist, but now look, I've got this whole list of different foods to eat. I'm not sure how to cook them. Where do I start? I've got supplements. I don't know what they mean. On the right-hand side, we have the coach. The coach is the expert in mindset and behavioural change who doesn't tell the client what to do. They don't make any recommendations. They don't make any judgments. They don't make any assessments. They simply say, I'm here, I'm listening, what's important to you? Let's talk about where you can start with this prescription that you have from your healthcare practitioner, whether that's a conventional or a lifestyle medic or a functional medicine expert, or whether it's a complementary or a holistic practitioner. You will come away with a set of things that they want you to do, which in their expert view will help you to get to better health. The health coach is the person then that sits by that client or that patient and helps them sort out, where do they start? What can they start with? Who needs to help? What happens if they make a goal, set a goal for their health, and something happens, I don't know, illness in the family, some other family issue, something. What are the challenges? Who needs to be with them? Have they got support? Where can they get support? With permission, they can give information. They do not give advice, but they can give information about any aspect of health. That's why we at the association insist that our health coaches come in with a really strong foundational level of health knowledge. This is not knowledge to use so that they can start interfering in other disciplines, business, but so that they have the language that they can talk to their client. They can also talk to a medical or a clinical partner if they're working with one. So that is really what health coaching itself is about. I mean, there's loads more I can tell you, but I probably need to get off quite soon. So I'm telling you guys, imploring you to understand health coaching is a transformational modality. It helps patients and clients transform their health because finally someone is listening. Finally, someone is allowing them to be in the driving seat as a co-pilot, if you will, with their expert practitioner. They're given confidence. They can be given information that doctors and other clinicians are too busy to give them. It transforms health professionals' practice. I'm sure that Rosemary would agree that health coaching has added a whole new dimension. The conversations that you have as a clinician, no matter what clinician, whether you're a doctor or an osteopath or a surgeon, oncologists, anaesthetists, we have all of those people in our association. Every single one of them, their practice is changed. They open conversations with a very different conversation. It's not about directing. Sometimes they have to say, my advice is strongly this, this, and this. But it comes from a place of much more equality, much more balanced relationship in that conversation. And health coaching is and will transform healthcare systems because we know we can't go on as we've been going on. We can't keep pumping money into healthcare and doing nothing different, expecting a different result. I'm saying that health coaching actually is going to make that difference. So I am saying to you that health coaching is the beating heart of integrative and personalised medicine. And that drawing that we've put together tries to epitomise how we're not saying we're the leader, we're saying we're that beating, quiet heart that supports every discipline, every pathway to health will be enhanced with a health coaching approach. This doesn't mean that all of you have to rush off and join Richard's training and become health coach. Oh yes, it does. It means that all of you must go and do the training. But there, you know, it adds to your portfolio of skills. That's all I can say. I strongly encourage you to, we do a lot of webinars to explain in much more detail what health coaching is about. They're all publicly available through Eventbrite, so please do join us if you can, and recordings are always available. So finally, I just want to leave you with this message that, as I say, we're on a voyage of discovery, but the real voyage is not in seeking new landscapes. It's actually in looking at what we have with new eyes. And I think that health coaching brings that new set of fresh eyes and fresh thinking. And if any of you haven't read our white paper on why we think health coaching can really support every sector in society with an interest in improving population health, needs to incorporate or work with health coaching. So with that, can get in touch, and I'm sure that Richard will make available this presentation. So with that, can get in touch, and I'm sure that Richard will make available this presentation afterwards. So that's it, folks. Thank you very much.